issue of covering HIV testing with health insurance. Do we all know that if two things are brought together, if HIV testing is in the benefit package of health insurance, six plus one health insurance schemes in this country. So if HIV testing is under in the benefit package of this, all the health insurance schemes in and if PLHIV are enrolled on health insurance and the general population is enrolled on health insurance under health insurance cover and they don't they pay their premiums or their premiums are paid for them, either provider initiated testing or client advanced in health insurance coverage for integration into health insurance scheme. Lagos is one where donors work. Donors have come to my project that I work on, US local, as its focus on sustainability for the HIV integration into health insurance schemes as a national right now in Nigeria. We are going to also move to other states as time goes on. Access HIV testing under health insurance and come in and request for a test. It will be paid for under fees for service. Capitation, and they don't have to pay anything. That is sustainability. And we have health workers using the money from. So bye to waiting for testing to deliver to you by any other person. You have your funds, HIV testing, and test people under health insurance cover. Donor driven and supported.
Thank you. Thank you. So you here focus on testing as a gateway to prevention and also um, health insurance scheme, both at the national and the sub-national level, take up this to supply the test kits as we have relied upon them for several years. So I'll go to Mrs. Oluwatoyi. I'll come to my dear brother here. We need to protect our women seated here. So you have listened to the contribution from Dr. Bolani. I will further. How do we think in making sure that the private sector and the public entities, both at the federal and the subnational level, take up these new roles? How do we think they should be better engaged? How do you think these government entities and private sector stakeholders should be?
Thank you very much. I also want to foundation. When you mentioned private sector being on this panel, it really demonstrates right. It is multi-sectoral, and one of the things collaboration is people understanding their vision, understanding the goal that they'll do. For us in civil society, when we hear public-private partnership, many times it sounds like a good thing, but then we're sure about, and that's the part about profit making for the private sector. Now, about public service or public good. Government wants to grow, but the private sector is not always all about the service, right? Because they also have something profit. So I think that in an engagement of public and private sector partnership, there should still be an and if people who need the service, who utilize the services, are not they're not in consultation or are not consulted in any form in such collaboration, there's a tendency that even though
what government feels, is the right thing to be done, is what is on the table, it might end up not, delivering on the promise or on the goal and the vision that it's supposed to deliver on. I'll give an example with hospitals. We know that for most people in this country, the first point of care for health care should be the primary health care. And that's what is accessible, should be accessible to you, from your house to, before you start going to other levels of care. And then we also see situations where private sector comes in to support the government to deliver health services, maybe the other. And sometimes we find that the primary need in, for example, a PhD is not what is being provided. Maybe it is now a big, some big equipment for some heavy diagnostic kind of thing. Not to say that is not needed, but it will take too many steps for somebody who needs care today to get to that people. There's other things, there's other levels of care. So if governments and the private sector would have conversations about case, there really needs to be the space to by the people so that this collaboration will work for. The next point I'm going to make is about the fact that understanding the goal, understanding the vision. For example, that this is the prevention plan and that should happen. How we can bring the money. But there's also other values, right? So that for that yes, you can or a private entity and you'll make up a business now and say we provide the way we can still make our our product to still speak to the promote prevention and other priorities. Have that alignment and that understanding are doing to also push government priorities. Because at the end of the day, it is all for the same people, it's the same society. And there's also the need for government to also push back, and or rather push the private sector, to go beyond their usual way of doing business, to start to align with things that work population and healthy society. So whether the person is making profit or the person is government who has responsibility to provide social services to people, at least we should understand that it is for a whole society, HIV-free Nigeria. And so it needs to come together from both the vision of the private sector and that of the government to make sure that it's delivering impact for the people. Thank you very much.
Thank you. Just for emphasis, my question was looking at how do we engage both public and private. I appreciate the fact that you dwell very well on the private sector engagement, especially the need to involve the clients or the people who will benefit, and also the need to put into cognizance the expected effect of health on the well-being of the population and the economy as a factor that should drive the interest of the private sector beyond the profit. And in taking it forward from there, I will just go to my dear brother, Dr. Anya, and you need to now. So I'm going to add the second leg of my question to your question. So your question is actually looking at how do we ensure the embedment of all of this new responsibility within the structure and the mandate of the MDAs, so that becomes the routine thing that they do rather than a one-time event. So, but in addition to that, how do you think the public sector stakeholders, particularly relevant ministry, department, agency, can be better engaged to take up this new roles and responsibility that's going to be faced down by the donor community? And how do we ensure that these roles and responsibilities are embedded within the existing structures and mandates of the national or subnational programs?
Thank you very much. How many questions do you have?
Two with branches.
Maybe let me address it this way. In the original multi-sectoral response, the whole idea of a multi-sectoral response was driven by the fact that at that time, people were simply just dying and being very sick, and therefore unavailable to teach, unavailable to do their secretarial work, unavailable to farm, unavailable to be in one office or the other. So everybody was affected. And right at the beginning, there wasn't. And so the focus was on creating awareness in every MDA, and then later on, making test kits available. So a lot of the workplace policies had to do with testing people and then eliminating stigma to creating awareness. And then when there was a little comfort with doing so, condom distribution was also introduced. Response. However, now I think that meant that everything that we were talking about in terms of HIV was focused on very specific HIV commodities. Our context in Nigeria, where the HIV is very low, our test high, our treatment coverage is high. I think we need to have a different orientation as to what is Let's take football as such. We used to call people who play football Nigerian Football Association, but no future ambition. But look at footballers, and it's not about the money. Because they want to play the same Manchester United, they don't go to the club, they don't take drugs, they obey curfews, they manage themselves because they've got to look. So the question then is how can contribute to giving young people had some conversations before now, and it seems the only thing to look forward to, you forgive me, is being a politician or being a musician or somebody in media by making a lot of noise or something. There seems to be no value in being a, but everybody needs a bed at the end of it. And even the musicians, their guitars are made by carpenters. So how do we change all of that? Because what we are saying is if a young person has passion, has drive, has internal motivation, has a value system, then they will conduct themselves in a different way that will reduce their risk of it. Before we even get to because it seems the whole of prevention is being complete. But we need to go back because that is what is sustainable. If we look in the NASA, for instance, the contribution of the proportion of expenditures on prevention was 2% in 2019, and something, 2 point something again in 2020, and then 9% in 2021. We find that that went to 60% of the 9 done is 1% of 9 money for a commodity that benefits a tiny group. Has no benefit. And then even the other commodity engaging, and then this whole other aspect. Yes,
Check the
can we actually
yeah.
the young people are more market, and therefore, as they are going to school, they know that
a project that was focused on expanding TB service. I was one of the very first of their success. And if you trace back that success, it goes to their private sector engagement strategy. They had a total overall of their private sector engagement and traced the truth. For years in this country, before and this model was replicated in Kano and all over the states in Nigeria. And guess what happened? Boom, an increase in TB case finding. So much so that Nigeria got itself a good name as one of the very few countries in the world whose TB case finding did not decline despite the in 2020, the year of COVID. In fact, our case finding went up. And the secret was private sector engagement in a proactive way. The UN, WHO, part of the UN has many documents that talk about private sector engagement. I will use those two later. There's a roadmap. 10 steps about engaging the private sector. You cannot shy away from the fact that they have to make. What you need to do is to align your goals with theirs and take them as partners and not the opposition and not the enemy. The disease you are trying to curb is the enemy. And they also have their own ethics as well. You don't just think they're all a bunch of people that just want to make money. They also have professional ethics. They are honorable men and women. And when you work with them, you will see appreciable progress. So in terms of my disposition, I'm blessed of that experience. And so I'm so open to collaborating with the private sector. And again, I'll go back to health insurance. These facilities I'm talking about in Lagos that buy their own tests, they're private facilities. Are they not aligning with our goals? They are. So we empanel them on health insurance. We have a grant with Flashma to empanel private a lot of any facility, but most of them are private. Because in Lagos, over 4,000 registered private facilities, emphasis on registered, 4,000 of them, just 1,000 public facilities. So what are you talking about? That means the populace in Lagos are being served by the private sector. And present leadership, they own that truth. They accept it. And they say we must move private sector. And so what we do is that when national empanels facilities, most of them are private facilities, not under PEFA or any donor. But guess what? Donor fund is supporting these facilities to be competent in HIV testing. And so what they do is that we empanel these facilities, we enroll patients, attach them to the facilities, and then they get capitation, they get fee for service, and then they buy test kits. So we don't see them as a threat at all, but as partners in progress.
Thank you. So as we round up, I've just been told that we have 10 minutes. I'm sure we know that we can't have enough time for this session. In my head, I have more than 1 million suggestions and experience that I have seen practically work on the field, especially when I left the very, very emotional field of HIV work, right? Uh, table of NACA as NACA and SACAs continue to live at the federal level and subnational level. And so we need to be very brief and be succinct as we recommend. How do we, what recommendation do you want to make to NACA? As we begin to look at transitioning some of these roles from the private donor funded projects to the public sector actors and the private sector in Nigeria. And private sector could deliver quality services, basic resources. What key recommendation do you want to give to NACA, particularly from civil society perspective, to ensure that this is done and these challenges we have discussed are mitigated?
On sports, it's still about us. It's still about a Nigeria that is HIV. Because, like you said in your interventions, that if HIV and not able to do this other work or that other work, then this other sector is also affected. As much as from the sectors down to our even our homes and what people can do. So government should talk to
and Nigeria will be heard. But the point is, we have to generate trust and confidence that we're not just talking and saying what we think will convince people to give money, and at the end of the day, there's no impact. So if we have conceptualized, we've discussed all the way to SACA, it's what has happened with PMTC.
Nigeria as a 2020 spent on health. 22%. That's that's about. If you look at pregnant women annually, we leverage on this permanent resource. Out of pocket expenditure is permanent resource. It's there. The problem is it is not properly harnessed. They are not properly spent, and when they are spent, they are not spent on things with scientific, value. So how do we work with these agencies who have pooled resources to make sure that as NACA agency that leads this available in-country resources into a better HIV prevention services. Thank you for this privilege of participation. monitored in country. My distinguished colleagues, Ms. Olu, to introduce our panelists for today. Thank you very much.
Okay, so we have five panelists. We have five panelists just to help us discuss this issue related to data and how we can strengthen it, and to ensure that it's optimized for decision making, and also strengthening implementation in country. We have Ms. Scott Adamu Oyegun from PEPFA. We have Ms. Omolabake Ekundayo, Mrs. Olufunke Ilesomi Odunlade, and we have Dr. Shion Oshogaba from NACA, and then Mr. Benjamin Pilata from Adrian. Mrs. Omolabake Ekundayo is from NASCA, NACA. That's Mr. Oluwaseun Oshagbami, and then Dr. Funke Odunlade is from the WHO. So you see that we have good representation of the people who should actually be discussing the issues related to data in this room. And we also welcome you, our audience, for taking time out of your busy schedule to be here and join this conversation. So we'll be throwing some questions to our panelists, and we would want them to dissect some of these issues related to data. Why is it that our PrEP data is not optimal? Why is it that every time data is being called for, we don't necessarily have adequate for the other programs, the other treatment programs and other areas of intervention for HIV? Why is it that PrEP is still suboptimal? So we'll be asking a series of questions that is going to be able to demystify some of these challenges for us to be able to address the issues related to data in the system, and also it falls within the get that's like the motto for the country right now. So we need to get even the PrEP and PEP data right. All right. So I'll hand over to our panelists. We have several sections for this session. There's a PrEP data systems and process PrEP indicators, PrEP data for impact and decision making, and then the um,
the enders.
Yes, hello.
Relatively
Sir?
feeling that we're going to talk about that is the fact that yes, this has the federal government through NASCAP and NASCAP not only have we identified that with one and that does that for the health sector. Now for the non-health sector, HIS platform data since last year. Gap is the fact that these systems for collecting PrEP data have informed the reason why we have that, we got that PrEP data. So basically, for me, I think that's the first from Ministry of Health and from NACA, which collects both health, like said earlier, as government, there's a need for us to that gap between health and non-health sector data. Bringing all of the health, all of trying to integrate all of them together. So we've got a system. So do we have gaps? The way we have been collecting data, but we tried to close that.
Know that there's already like strategies in place to address the issues related to data reporting for PrEP, and also hear that the health system reporting. So I guess as we go and how this system can be harmonized, but gathering experiences from experiences. The next question is to the PEPFAR representation. Based on experiences with other disease programs and HIV treatment services, how best can reporting platforms? Thank you. Thank you, Master, for providing. PrEP is really towards on prevention, and as much as